Landon Joel. When he was born, he was a spitting image of his big sister.
Welcome to Still a Part of Us, a place where moms and dads share the story of their child who was stillborn or who died in infancy. I'm Winter.
And I'm Lee. We are grateful you joined us today. Please note that this is a story of loss and has triggers.
Thanks to our lost parents who are willing to be vulnerable and share their children with us.
If you're listening to this podcast, just know that on our YouTube channel there are pictures and videos that are related to the stories that are being shared.
Subscribe and share it with a friend that might need it and tell them to subscribe. Why? Because people need to know that even though our babies are no longer with us, they're still a part of us. Welcome to Still a Part of Us. I'm just so pleased to talk with Sarah today. She reached out to me and I was just blown away how difficult her story was to read even. And so I'm looking forward to hearing a little bit more about her story and about her son, Landon. So welcome, Sarah. Thank you so much for coming on today.
Thank you for having me. I'm glad to be here.
So to get us started, can you tell us a little bit about yourself, where you're located in the country, as well as what your family looks like?
So I live currently in Centerville, Maryland. My husband is in the Navy. He's actually stationed with the Naval Academy Band.
Oh,
And so, yeah, he plays the trumpet for a living.
nice.
Yeah, we've been here for the last 6 years or so. And this is where we began our family. We have 3 kids that are living. And then, of course, our angel baby, Landon. So we've had 4 children together. And yeah, that's where we are.
That's awesome. And to give us a little bit of context, can you tell us when Landon was born?
So he was born on February 26th, 2021.
Okay. And tell me a little bit about your family. You guys are in Maryland. I think that's pretty rad that he plays in the band.
Yeah.
I just think that's so rad because I played the clarinet and my husband played the trumpet when in high school and college and stuff. So that's why I'm like, that's
cool.
so neat.
Yeah.
But what do you guys like to do as a family? You have young kids, right? Is that right?
Mm-hmm. Mm-hmm.
So
yeah. So our children are 1, 2, and 6. So they're little. Well, the little ones are little. And then as a family, honestly, because of where we live, there's so many different things around us. So, we just, a lot of times it's just go to the park, or my oldest loves to go swimming. So we might go to the local pool, or she'll just play with the neighbors, or they all love to jump on the trampoline. So with our schedules, it's really hard to actually go do something for a weekend because of my husband and I's work schedule. But just simple things, even just a wagon walk around the block at nighttime or something. So
yeah, but it sounds like just spending time as a family is pretty. I mean, I guess with littles that it is basically what you do. You spend time as a family together.
Yes, yep, absolutely.
Oh, and I know that we're going to get into this in a little bit, but tell me what you do for work as well, because that will play into a little bit of this story.
I am a labor and delivery nurse at the hospital where I had Landon and all my other kids.
Yeah. So we'll definitely play into it. So thank you so much for that introduction. Okay. So you have a 6-year-old, a 2 and a 1-year-old. And and Landon would would he be number 2?
Yeah. So he would have been number 2. My oldest, Chloe, was going to be 3 when he was born.
Okay.
And so he was baby number 2 for us.
Okay. And so let's talk a little bit about your fertility and your pregnancy journey. Were you guys planning on having a number 2? Was he a surprise, or that was definitely in the cards for you guys and as your family?
So he was definitely in the cards. He was planned. And I think, and we'll get into it, but I think that's what makes it so difficult is, with Chloe, I met my husband when I was 28.
Mm-hmm.
We got married when I was 29, and we wanted kids right away because we had met a little bit later on in life. And it took us about 7 months to get pregnant with Chloe, which fell in the time of normal. And when she was about 8 months old, we decided to start trying again because we were worried that it would take a while like it did with her.
Yeah.
And it absolutely did. And, this was right before COVID really started to ramp up, and we were under the care of reproductive endocrinology or a fertility doctor just to do a workup, because I think it had been like 9 months of us trying and we still hadn't gotten pregnant.
Okay.
And just wanted to make sure everything was otherwise normal with my hormones and everything else. And I was super irregular, so it was really hard to track, when you were fertile.
Yeah.
Right. And everything came back totally normal. And we were going to be starting just like a fertility medication, kind of like Clomid, but it was called letrozole, just to help you ovulate. And we were going to do like a timed intercourse route, because there was nothing else wrong with either of us. We were basically perfect in our fertility, which is so frustrating. And waiting to be able to start that, they had stopped all of the elective fertility procedures because, again, COVID was starting to ramp up and they were trying to be safe. And we ended up getting pregnant on our own about a year after we tried.
Okay.
And that ended in a miscarriage 2 weeks later.
Oh.
And so that was really hard and defeating, as you can imagine.
Yeah.
And then we had to wait for them to resume the elective procedures. And so we finally were able to do timed intercourse. It did not work the first time. They were just monitoring my follicle to see which egg was getting the biggest. And then, telling you, like through ultrasound, you had to go every couple of days.
Yes,
for those that don't know what timed intercourse is, you take the medication to help you ovulate. And then you go for ultrasound follow-ups every couple of days, just so they can measure the follicle that's dominating and growing the biggest. And in this time is when they actually noticed I had PCOS, but I don't fit the typical mold of PCOS, which is interesting. They called it lean PCOS. I don't know. So anyway, so the first month we had 2 mature eggs. And so there was a chance we could have had twins, but it didn't work. The next month, same thing, 2 eggs, and ended up getting pregnant with Landon. And we found out July 15th that we were pregnant with him. And it was really exciting. I was really nervous, of course, because we had just had miscarriage. And at this point where, gosh, I don't know, I would say about a year and a half into us trying for a second after Chloe was born. Maybe it was more like a year. I can't remember exactly the time frame. And so we did the blood work just to measure, the pregnancy hormone, make sure it was doubling. For people who are under fertility treatment, what they like to see, or like a sign of a viable pregnancy, is they'll draw your HCG, and then every couple of days they make sure that it's at least doubling, and that's a sign of a viable pregnancy. So we had to do that 3 times, which is nerve-wracking each time, and all of that looked great. And so then we did the ultrasound at 6 weeks. There was no heartbeat. Came back at 7 weeks, and there was a little tiny flicker. And, he looked great. And after that, they released us to just regular.
Okay, so even at the 6-week one, you didn't see the heartbeat, but was that considered necessarily irregular?
They said normally in early pregnancy, you can start to see it as early as 6 weeks, but sometimes you won't see it until more like 7, because they're still so tiny.
Yes.
So at that 7 week, if there wasn't a heartbeat yet, then they would have considered that maybe it wasn't going to be a viable pregnancy, that it didn't develop appropriately. So the whole beginning of his pregnancy was just filled with all of this anxiety of, is it even a normal pregnancy? Why is there no heart? So it was just, it was a hard journey to begin with. And I think at the 16-week mark, we didn't do any of the genetic testing. I don't even think we did it with Chloe, my oldest, who's 6 now, because it wasn't going to change our decision. I just felt like I didn't want to know. I don't know why that was. We just didn't want to know. And so we were fine with not doing the genetic testing. And so at 16 weeks, I think, was the earliest you can do your anatomy scan with your OB. And that's when we did it. And that's when we found out that we were having a boy. And so he was definitely planned, and we had to work pretty hard to get him. Which makes it difficult that what happened.
There's I don't think people realize that there's some struggle and sadness that can be associated with a fertility journey as well. And so I can relate to when I was like, yep, going in and getting all of those, and then hoping that it's going to continue and stick, right? And so so you guys found out well, let me just back up really quickly. So that from when you were turned over to your actual regular OBGYN, were you being seen kind of regularly there also? Because sometimes they still kind of keep a more regular, more often if you have gone through IVF. I mean, like all of the fertility things.
Yeah.
So
I was seen just like a normal
okay,
pregnant. I wasn't looked at
they
as high risk or,
okay,
I didn't have anything special going on. He
yeah,
was just a fertility baby. That was
okay,
really it. There was nothing in my history that, warranted being seen more regularly.
gotcha. And were there any issues? Were they worried about the PCOS? Um, okay,
No, not really.
okay,
They weren't. And I think another thing that makes it so hard and, and when we get to it, the wondering, like, was there something that was missed kind of thing
yeah,
is, again, because it was during COVID, a lot of my appointments were just Zoom check-in. So it was
yeah,
more like, how are you feeling? Any complications? Are you feeling the baby move? Okay, good. So you weren't having your blood pressure monitored. You weren't having that, when you pee in a cup at the
yeah,
doctor and they test it for protein because they're looking for signs of preeclampsia, which
yeah,
is, a horrible thing to have in pregnancy.
yep.
It can be very severe. All of those things. You weren't getting that. It was just a phone call. How are you doing? How are you feeling? So it was almost every other visit you would see your provider and they would do the quick little Doppler for the heartbeat. But beyond my anatomy scan with Landon, I never had any other ultrasound or anything like that.
And so, and also, so let me just also point out to everybody because we have like a lot of people have moved on from COVID, right? But just to,
Yeah.
I mean, I just want to point out that there was a lot of restrictions in the hospitals, and because of that, there was like I don't know, was your husband able to go to some of those ones you actually got to be in person? No, like that's the thing that's so
No,
frustrating
he
because
wasn't allowed. No. And
yeah,
actually he wasn't even allowed at the anatomy scan
oh
ultrasound either. He
really?
wasn't allowed to be there. Yeah, I remember I had to FaceTime him because he wasn't allowed. He was in the car, but he wasn't allowed to come inside, which was frustrating because again, he was
Yes,
a fertility baby. We worked hard for him
yeah,
and he's not reveling in that joy that we should feel as we're having another baby,
yeah. That is really frustrating. That has been a common theme of just like, oh, feels so unfair because of that. And there's
Yeah,
reasons for the restrictions, but that is so hard in these situations because babies are still
right.
being made. And yeah.
Right. And I mean, it's his baby too, it's
Oh,
not,
yes.
it just wasn't fair at all. And I remember that he wasn't allowed to be there.
Yeah.
So he felt it was almost like he was just so, I don't want to say disconnected or disassociated, but he didn't feel involved in the pregnancy because he
Yeah.
was limited,
Yes.
so for him, it's just, there's a baby in there, but I'm not really included the way that he was with Chloe. And so that excitement for him kind of got diminished.
Yeah, for sure. I think that
Yeah.
has been a common theme when I've talked to people that have had babies during COVID times. So when you did have the anatomy scan, and you wanted to find out what the gender
Yes.
was, is that right? Okay. So you
Mhm.
found out, did you was your husband FaceTimed with you at that time when you found out? So you guys both found out at the same time essentially?
Yeah. Yeah. We found out at the same time that it was a boy. And I remember being really excited
Yeah.
because we were going to have one of each. And we had decided that Landon was going to be it for us. We had a girl, now we had a boy. I didn't want to do this journey of trying anymore because it was just so disheartening to
Yeah.
lose a pregnancy. Granted, I was 6 weeks when I miscarried before Landon, but it was
Yeah.
still so hard
Yeah.
because, it is still a baby. It's still it, and so I just didn't want to do that journey anymore. I wanted him to be it. I didn't want to deal with pregnancy and the stress and the anxiety of it all. We were in COVID times.
Yeah.
We decided, that was going to be it and that we were done. And, I remember, again, I was excited, but I remembered, I think Daniel was just he was just kind of meh because he didn't know how he felt about having a boy.
Oh,
And,
okay.
and that was, that was difficult too. And when it came to losing him, because he was afraid to have a son because he didn't feel like he really bonded with his dad growing up.
Mhm.
And I think he was afraid that he wouldn't be able to love a son the way he loved our daughter, which I knew was never going to be the case. But he just was really nervous about having a boy. And
Yeah.
so subsequently I did feel like he was very hands off in my pregnancy with him. He didn't really want to touch my belly when he was kicking, didn't really talk much about him, and so it wasn't really until like a month before he was gone that Daniel really started to get excited about having a boy and like feel this bond of, okay, we're going to be fine. Like, this is my son. And, so that made it really hard too. It's just feeling like he didn't even want him. And that's not the case. That's how I interpreted the situation of we're having another baby, but it's not a girl like you wanted. And so you don't seem like you're excited about the pregnancy the way that I am. So that was hard. That was another battle that I kind of had to go through after everything happened.
Yeah. No, totally. Like, yeah, I think the dads usually do have a hard time, right? They have a hard time bonding because they're not the one carrying the baby, and that add COVID and the restrictions there. Yeah. There's kind of a lot of layers there for sure. And I can imagine
absolutely.
that was something that would be a struggle. Okay. So then you found out you were having a boy. Did you announce it to family? I know, once again, people aren't getting together necessarily to do these kind of little parties
Yeah, we did announce it, and we had the way it was such a cute little, people are doing the gender announcement pictures and all these different things now. So I really wanted to do just like a cute little, we did a gender reveal, but we also did a regular pregnancy announcement photo. And for me, it's so hard to look at those photos because we were so happy then, It's not that we're not happy now. It's just, there was so much joy there, a different kind of joy. And, the way that we did like the pregnancy announcement is we put Chloe at this cute little kids table that we had with one pink and one blue balloon. And we put it on the Naval Academy grounds, like behind these really pretty, like flower trees or bushes.
Yeah.
So we had like one chair, 2 chairs with a little table. And then Chloe was in this cute little dress. And we had a sign that said, it was our last name, which I won't say.
Yeah.
And then it said party of 2 coming soon. And so there was like an empty chair at Chloe's table where the baby brother would have, So a party of 2 and one pink balloon, one blue balloon. And it was a really cute photo. And then when we found out it was a boy, we had Chloe like pop the gender reveal balloon and like the balloon everywhere. And so we put that video like in slow motion, and you can see her face like going like this because like the confetti of the balloon is like going right at her. And so that's what we posted. We did, the typical like photos, and we wanted to do something cute. And we never announced our pregnancy again after him with any of my kids. It was a secret on Facebook, like social media. It was a secret because I didn't want to have to explain again that lost a baby if I would have. And I didn't want to go through that again. So the 2 kids we had after him were a total surprise. Half the people didn't even know I was pregnant, unless they were in my immediate life.
Yeah.
It was a way to protect ourselves. So
I totally we did the same thing with our pregnancy after we lost it also. Cause you just, your heart cannot take having to announce the death too. Like that. Yeah. And did you guys, did you have any names for Landon? Was that something that you knew?
I think that was always going to be like just other names.
Yeah.
You mean? Like that was always going to be his name. So
really?
Yeah. When we got pregnant with Chloe, actually the night we got engaged, we had picked out girl names. Like we had picked out 3 girl names that we liked. And I can't remember the third, but I know that Chloe and Bailey were on there, which is the 2 daughters that I have. We have Chloe and a Bailey. And I don't remember what else we had picked, but we didn't really have a boy name set in stone.
Okay.
But when I was pregnant with Chloe and we were talking about, okay, if it's a boy, what do we like?
Yeah.
It was just immediately for me, it was Landon. That was the name I always loved. And I remember it from A Walk to Remember, if you've ever seen that movie. With, I can't remember the actor's name, but Mandy Moore is in it. And the character is Landon. And I always thought that was like a really nice name. And and we named him Landon Joel because kind of silly maybe, but Daniel's favorite singer of all time is Billy Joel. Absolutely loves Billy Joel. And I was like, what if we made Landon's middle name Joel and we called him like LJ as a nickname? He's like, yeah, I like that. That's cute.
That is really cute.
And so that's how his name came to be. He was going to be Landon Joel, LJ,
That's
so
really, really cute.
We never changed it. That was his name.
And you guys referred to him as that throughout the pregnancy. I guess once you found out that he was a boy. So, okay. So you went in for that, that ultrasound and this is like late 2020, right? Is that right? So this is late 2020 and things are really starting to pick up in the US for the COVID. So the restrictions are very solidly there. Like it is very difficult to get people in. And so, so every other visit, because are going to start getting more and more visits as you get to the end of your pregnancy.
Right.
So you're working at the same time, right?
I wasn't a nurse at that time.
At that time, you were not a nurse. Okay, so can you tell us how that was working, how you were working at that time while you were pregnant during COVID?
Yes. During COVID, I worked at the same hospital that I work at now, but I was actually a respiratory therapist, which was the worst career to have during COVID.
During
So
COVID.
a
Yeah.
respiratory therapist does all different kinds of things, but most notably, they're the ones that manage like a patient who's on a ventilator with a breathing tube. They'll manage the ventilator. They'll help the doctor put the breathing tube in. If there's an emergency, patients in cardiac arrest, anything like that. So that's most notably what we as the RTs were doing during COVID. And me being pregnant with Landon, I don't know how I got roped into it, but I was in the ICU more than I was anywhere else in the hospital. I think they felt that was the safest place for me to be, because in the ER, it was taking so long for us to COVID test patients that we didn't know if you had COVID or not. We had to act like everybody had COVID.
Yeah. Okay.
Or even up on like the medical floors for patients who were on like what we call high flow oxygen therapy, which is, more than a nasal cannula oxygen, but it's not quite as invasive as a ventilator.
Yeah.
Anyway, it's just a different way of giving you oxygen. If we had to go into those patients' rooms that had COVID, we had to do, full N95 mask and a gown and gloves, but you had to change it with each patient. So it was a lot of in and out, in and out, in and out if I would have had that assignment. So I think my coworkers felt like the ICU was safer because the ventilator we found a way to put it outside of the room, and our ICU had glass sliding doors. And so I could just look at the ventilator, peek in on the patient without physically having to go in the room unless I needed to.
Okay.
And it was a way to kind of keep myself safer. And I had this really special fancy mask called a capper. And we only had a few of them in the hospital, but it's like this helmet that blows air kind of. And so like it purifies the air, you can breathe. And it was a lot safer for me to wear that than to wear like an N95 mask. And I have it when I should have emailed you a picture of me wearing the capper when I was pregnant with Landon. I have it somewhere. But
yeah, you guys, so because I'm in healthcare too, and we get training on that occasionally, but it looks like a spacesuit. Like it looks like a spacesuit helmet. If you think about it, there's like tubes coming into it, and it's like it's a whole thing. And you have to wipe things down, and I mean it's really time intensive. It's not super easy. Even just get like the gowning up and everything, but the capper seems like it's just like so much extra.
Yeah. So the respiratory department was actually located in the middle of the ICU, and our hospital that I work at is really large. So to put it into perspective, if I wasn't assigned to the ICU and I was assigned to maybe some of the other medical floors where we had other patients that needed to be seen, was a lot further for me to have to walk and like travel around. So again, being pregnant, and I was just very uncomfortable with my pregnancy with Landon. I'm not sure what it was, but I just always felt like I was in so much pain. Just the way that my belly, the way I carried him, I don't know. It's just, and I never felt that with Chloe. So I thought, well, maybe it's just because he's my second, your abdomen is a little bit more separated between pregnancies.
Yeah.
But I just was very uncomfortable. It was hard to even stand up. And I don't know what that was all about, really. Nobody could figure it out. So anyway, I was mostly in the ICU where it was close to the department, and it was just a short little circle that I had to do. And it felt the safer choice for the assignments that I had. So during my pregnancy with Landon, I was working as respiratory therapy.
Which is, that was one of the things that I was like, oh my gosh, are you kidding me? I would be like, but we know so much more about COVID and like the impact that it's had. And were you feeling okay with the decisions that they had you in the ICU? How were you feeling about that?
I was feeling nervous because, here we are surrounded by this scary virus that seems to be killing a lot of people. And, just me being pregnant, we didn't know how that was going to affect the pregnancy or myself. And, I unfortunately wasn't in a position to not work. Financially, we needed my paycheck, but I wasn't going to just quit and try to find something else when I was pregnant. It was this whole thing. So I just, PRN employee at the time, which basically means you're not full-time, you're not part-time, you're not guaranteed any hours, you just kind of pick up as needed. At that point, they were actually offering so much more per hour for you to pick up because they were desperate. So even though I didn't want to work in that environment, I also knew that we needed financially for me to be able to do that. And so I think in the end I was most okay with the ICU assignment, which I know sounds strange, but I had known the nurses. I've worked there, and they came to know me. And so a lot of our ICU nurses were very seasoned. They'd been doing this for a while.
Yeah.
And so, seeing me in my pregnant belly, they always said, Sarah, please don't go in the room unless you need to. If you need something, if you need to go, we would have to like suction the patient, their breathing tube to make sure we were clearing out the secretions and preventing pneumonia the best that we can. Just being on the ventilator, you're more prone to pneumonia. And so the nurses would do that for me. They wouldn't have me go in their room for anything at all unless I absolutely needed to. So I really appreciated that. And I just, looked at the ventilator and the patient and like checked on them that way. But the nurses were also very protective toward me and tried to shield me from as much exposure as possible. So I felt okay with it, but it was still scary, of course. We just had a lot of really, really sick patients. It was very morbid.
Yeah. Well, I have friends that have worked in the ICU during that time, and it is just like completely, it was hard. Very, very hard.
Yeah.
Oh, and let's go back to how you were feeling, how the pregnancy was actually affecting you. It sounds like you were in a lot of pain. Like, so first trimester, were you sick or?
I was. So I was sick with Chloe also, and I think I was actually the most sick with her.
Okay.
Maybe it's just because, that was my first pregnancy, and so it's a different kind of sickness. But yes, with Landon, I was still pretty sick, like right at the 6-week mark. I was sick every day for weeks. It was, I feel like it was at least until 22 or 23 weeks before I started feeling better.
Okay.
That was really hard.
Yeah.
There wasn't a lot of things that I could eat. I had a lot of food aversion, but I did Chloe too. I was turned off by chicken, like in any form. And it was the same with Chloe. And with Chloe, I wanted everything really sweet and sugary. With him, I wanted savory. I wanted salty.
Oh, okay.
So, there's a lot of like salty things that I wanted to eat. And, I was really sick with him. And I think I felt better during nighttime than I did in the daytime, which is ironic. And because I was a night shift worker, so I felt okay being at work, but during the day I felt absolutely miserable. And I was sick for a long time with him, and just being really uncomfortable. I don't know if it was the way he was laying in my uterus. When we get to the rest of the story, I have theories. I can never prove any of them, but my theory is the pain that I was feeling was related to the fact that he had a short cord. We realized, like, after they did the the pathology report on the placenta when he was born, he did have a short cord.
Okay.
But I think because of that, he didn't have a lot of room to kind of like move toward more the back of my uterus. So he was just kind of like laying in the front.
Yeah.
And it would just kind of like weigh it down. And so it was just very uncomfortable. And I haven't felt that with any of my other kids. I don't know. One of my OBs suggested that maybe it was like micro tearing of my skin, that you couldn't see it, but it was feeling like it was tearing.
Oh.
I don't know. It was just very uncomfortable. It was hard to stand up without being in pain. I tried all the abdominal support, pregnancy binder things. That didn't do anything for me. I was very large with him. I was very, very big with him, bigger than I was with any of my other children. And I don't know. When we did the gestational diabetes test, this is another part of my theory. I was so afraid to fail the test because I didn't want to have gestational diabetes. I didn't have it with Chloe. I didn't have anything with Chloe. Totally normal textbook pregnancy. No blood pressure issues, nothing. And with him, I was so afraid to have gestational diabetes for whatever reason that when you do your, that drink to do your blood sugar testing for at 28 weeks of pregnancy or whatever week it is for them to test for that, you're not supposed to fast. But I did because I didn't want to fail it. And so I didn't eat that morning at all. And when I took the drink and they did the test, my blood sugar level was barely passing that 1 hour fasting or
Oh,
that 1 hour
even
test.
having
And
been
that was
fasting.
even having not eaten for that whole day.
Yeah.
And so I was naive. I didn't know a lot of pregnancy things. Now I do because it's the field that I work in. But
Mhm.
in my mind, I was like, okay, cool. I passed it. I don't have to worry about this 3 hour test and drinking that whole
Even worse.
3 hour.
Yeah.
Yeah, I didn't want to go through that. I'm like, okay, awesome. Like, no gestational diabetes. But I was really large with him, and
Mhm.
patients who have gestational diabetes tend to have a lot more amniotic fluid.
Yeah.
Um, and so I now one of my theories is that I did have it. I just
Mhm.
didn't know it because I chose to fast. And one of the reasons why I wonder if I had it is because the morning that we lost him and they did all my lab work, my glucose was like 279 that morning.
Oh,
That's really high.
it is really
And I
high.
didn't
Yeah.
eat that day. I had not eaten that
Oh,
morning. So for it to be as high as it
yeah.
was,
Yeah.
unless it was a stress response, I don't know.
Interesting.
I
Y-
But so I do wonder if that could have played a part in why I was so uncomfortable, because I did have gestational diabetes, and
Yeah.
he was a decent weight when he was born at his station. So
Yeah. You're not being technically seen as often in the office, and so but they were you said you yourself was big, you were feeling really big. They usually
Mhm.
kind of, like, can do measurements and everything, or were they keeping an eye on that type of thing? Were they mentioning, "Oh, this
Yeah.
is, you're measuring larger than usual." I mean, than the
Yeah.
gestational age.
All their measurements were always okay.
Yeah, okay.
Again, I wasn't having any ultrasounds done for them, because with an ultrasound, they can also measure how much amniotic fluid is in there. They
Mhm.
weren't doing any of that because I was a normal pregnancy. They were doing like the fundal height, the tape measure around your
Yep.
belly when you're pregnant, because that's supposed to line up with how many weeks pregnant you are.
Yeah.
And if it's smaller or bigger, that's when it kind of clues them into, is there something going
Some
on in the pregnancy where the baby's growing too much or not growing enough? But I was always right on par. And so it was within normal, but I felt huge, and but
okay.
they didn't seem concerned by it at all.
Okay. Yeah, that's kind of it's so frustrating. I was like, COVID, like because there's so many things that
I
you feel
know.
like, gosh, if there was a little bit more monitoring, maybe things would be different. And yeah, so you're going along, and you were deemed a normal pregnancy. So you weren't necessarily ordered like stress tests either, right? The non-stress tests. Okay, so no for those, and then did you guys end up? I guess what was the plan when you were gonna get when you were delivering? Because I once what was your hospital's policy for the actual birth plan, birth preferences during that time?
Yeah,
I'm hoping your
you could
husband was
just
able
have
to come
your
in.
yeah. So we'll back up a little bit.
Yeah.
So my original due date with Landon was, I think, March 28th or 29th, somewhere in there. And he was born February 26th.
Okay.
Before that, I remember it was my nephew's birthday, February 5th. I
Okay.
was working night shift, and I just I just started to feel weird. And I'll back up even more. When I knew I was pregnant with Landon, I don't know what it was, but I always felt doomed for some reason. I always felt like something bad was going to happen. And I don't know if that's just because the journey to get to him was so hard and I was afraid,
Yeah.
but I always just felt like something was wrong. Something was wrong. I don't know, which now looking back at it, it was weird to kind of have, I don't want to call it intuition, but to just feel doomed from the beginning. So I had been feeling kind of like weird at different times, like up and on days. I just felt weird, and I didn't know how to explain that. And when I did have my video OB appointments, they would be like, "Oh, how's everything feeling?" And I was just like, "I just feel kind of weird." And
Hmm.
they kind of wrote it off, and they're like, "Well, since we're doing video appointments pretty frequently, I'm gonna have you get just like a blood pressure cuff for like your wrist or your arm, like order one and monitor your blood pressures from home, just so we can kind of keep an eye on that at least." And I was like, "Okay." They were always okay. And then one day I was at work, and I just felt really weird, and I don't know what it was, but something in me was like, "Just take your blood pressure."
Mm.
And so I did, and it was telling me it was something crazy, like 172 over,
Ooh.
I don't know, 90 something, which I'm a normal, like one teens over 80s is like my normal, or one teens over 70s during my pregnancy with Landon. Like I have a normal blood
Yeah.
pressure. So for it to go up that high,
Yep.
of course I'm thinking, preeclampsia, because high
Mm-hmm.
blood pressure can lead
Mm-hmm.
to, that can be a sign of preeclampsia, and I was panicking because at this point, Landon was like 35 weeks, 34 and a half weeks gestation. And I was like, oh my gosh, it's too early to have a baby
Yeah.
if this
Yeah.
is preeclampsia, because I always say the cure for preeclampsia is delivery, because the problem lies within that placenta. And when you deliver, theoretically, the preeclampsia problem should go away.
Yeah.
So after that, I told who was in charge, because we always had a charge RT, that, hey, I need to walk over to the ER, not the ER, labor and delivery,
Yeah.
to be evaluated. My blood pressure is really high. I'm crying at this point because I'm scared and I
Yeah.
feel weird. You don't know what's happening. And so I walk over to labor and delivery, and they get me into triage, and they do like a whole workup. They draw my labs, they look at my blood pressures. They were fine while I was there. And, they monitored me for a couple of hours. That was the only NST that I ever had, because I
Okay.
was on the monitor and Landon looked great. There was nothing that they
Okay.
saw on his tracing that was concerning. And during my visit there, the nurse who triaged me, her name was Jan. And I actually work with Jan now and talk to her often.
Mm-hmm.
And I just remember being in the triage room and trying to get the hospital gown on, and I'm just sobbing because I'm so scared that something is wrong with Landon. Because again, I had this feeling of something is going to happen this
Yeah.
pregnancy. I think it was just me feeling like maybe this is what it was going to be. Maybe it's preeclampsia. I've never had blood pressure issues, so I was feeling nervous.
Yeah.
And Jan was so, so sweet. And, she has, I couldn't really see her face because of
Right.
everything you had to
Yeah.
wear during COVID, but she was very sweet. And, she triaged me, got all my labs, assured me that everything looked good. And I very vividly remember, again, I had mentioned earlier that Daniel kind of felt for me like he was disconnected from the pregnancy,
Mm-hmm.
that he wasn't very involved. And I distinctly remember being in L&D, telling him, right before I walked over, my blood pressure's high. I'm leaving work to go to L&D to be seen. And normally something like that, it's like 2:00 in the morning, 1:00 in the morning, maybe it's the middle of the night, because I was a night shift worker. Of course he would be sleeping, but something like that, normally Daniel's very much the type where he would be awake and concerned, and he couldn't come see me because we have Chloe at home for one, but
Right.
COVID,
Yeah. Mm-hmm.
the whole time I was in L&D, he didn't check on me at all. He didn't text for updates, nothing.
Mm-hmm.
He just fell back to sleep like he wasn't concerned. And I remember really being bothered by that, because what if I would have had to deliver that night? What if something would have gone wrong and they had to do like an emergency C-section, and you weren't even, in my mind, you weren't caring enough to even stay awake and say, how's everything looking?
Yeah.
And, to kind of fast forward a little bit into the future, he never, when I was pregnant with our two children after Landon, he was always very like, is everything okay? How's your
Yeah.
NS? Because I was much more monitored after Landon, like
Right.
with
Yeah.
fetal medicine. So when I would have the NFTs or even just a regular appointment, he was always like, how's everything? Is everything looking good? Is everything okay? What they say. So he was much more involved. And I don't know if that's because we lost a child. I don't know, but it's always just been hard for me to wrap my head around how you could be so disconnected with Landon and feeling like you don't want to stay awake to at least check in.
Yeah.
For the 2.5 hours I was in the ER,
Yeah.
he didn't text me at all. Then when I came home, he didn't seem concerned.
Mm.
And then to be so concerned with the children after him, it's hard to know if it's because Landon was a boy, is what I'm getting at. And
Right. Yeah.
he says it's not, but we've, our marriage has survived something horrible, and it was really taxing on us at one point, and we've gotten to the other side of it, and we're celebrating our 8 years of marriage
Yay.
next week, actually. So, but it's just something that when we were trying to get over everything that happened, it was something I always thought about, and I still think about it.
Yeah.
Did you just not want him?
Yeah.
So
Oh, yes. These these can try a marriage, and yeah, who knows the reaction. Yeah. That's hard. Your Everything was good when you actually went to triage.
Yes.
Did you end up monitoring your blood pressures after when you got home slash throughout the rest of the time? Like, were you just trying to be a little bit more concerned slash vigilant about checking that?
I was, yes. And all the labs came back fine. There was nothing that would show preeclampsia. I didn't have like protein in my nothing. And I don't even think that they
Interesting.
checked like my glucose level at that point
Yeah.
because remember the day that Landon was born, it was 200 something.
Right.
I don't think they checked it then. And even if they had, I don't think they would have.
Thought any probably yeah.
No, no, but everything was normal. And my blood pressures and triage were all completely normal.
Hmm.
Um, and so Jan and I actually really bonded in that short 2-hour visit,
Yeah.
and I think I just impacted her because I was working during COVID and I was an employee at that hospital and I was just so scared and we just really bonded and
Um.
she was just wonderful when I needed, in that moment. She was
Somebody.
just very supportive and wonderful. And again, I still work with her. She's charge nurse on the weekends, so I work with her a lot. She's fantastic. Um, which I think is really poetic, actually, to know her from me being a patient to knowing her now as
It's a
being a
coworker.
nurse and,
Yeah.
and all of that. But yeah, everything was good. I was discharged home.
And that was
I
about 34 weeks ish, would you say?
34-ish because on February 26th, when he was born, I was 35 weeks and 5 days.
Okay. Yeah.
And this was February 5th. So yeah,
Yeah.
33-ish,
So
34-ish
yeah.
weeks, somewhere in
Okay.
there because it's
So
a couple
still,
weeks before.
yeah. And so
Yeah.
obviously we don't want babies to come too early because that would cause issues with all sorts of development and lungs and that type of thing. So
hmm
obviously being scared for the baby to come at that time would be concerning. So, for a number of
Yeah.
other reasons,
Yeah.
because the NICUs were also really hard to get, like COVID really put a lot of
Yeah.
restrictions on that too. So there was I can see all the levels of just how
Mhm.
difficult that would have been at
Yeah.
that time if you
Yeah.
had to go in for an emergency C-section or something. Um,
Yeah.
yeah, I'm like, oh, okay. So you're going along, you're still working, still not feeling great, sounds like. So
Right.
tell me, have I missed anything in particular between that time from that kind of triage time you were in L&D to when things kind of went different?
I don't I don't think so. I had my last day of work. I think it was like around Valentine's Day
Okay.
because I had planned to just like be done with work for a while. I was just so uncomfortable. I wanted to just be at home until we were going to have Landon and I felt like financially we could have done that and I just needed to just be done and off my
Rest.
feet and
Yes.
all of that. So I think it was around Valentine's Day and they had like this nice little baby shower for me at work
Oh.
and it was really special and then yeah, so in this time I'm trying to think we were getting our basement remodeled. I remember because it took a few weeks and they were still remodeling it the day that he was born when I
Oh.
woke up starting to feel
Yeah.
everything. When we
Yeah.
get there, I'll explain that. But yeah, so we were remodeling our basement and we were just waiting to have him. And I remember very vividly the night before we had him that our contractor was over
Mm.
at the house. And like we were just like
Trying to.
talking. And
Yeah.
yeah, I was just sitting on the couch and feeling Landon kick and move. And it's just a normal day.
Mm-hmm.
And yeah, that was February 25th. And I went to bed and Landon always kicked me the most when I ate ice cream. He liked ice cream.
Yeah.
And I remember, I don't know if you remember this or other people do, but during COVID, a lot of the schools like would give you like those school lunches
Yeah.
during the
Mm-hmm.
yeah, yeah,
Mm-hmm.
that whole thing. And so we lived down the street from one of the elementary schools.
Yeah.
And we would go almost every day to just get like, the food because it was easy to give that to Chloe. And they would always give you like 2 or 3 of like the school size milks, right? Like in the carton, like the
Mm-hmm.
little
Yeah.
cardboard box
Mm-hmm.
carton thing. So I remember being in bed eating ice cream. It's like 9 o'clock at night and I'm drinking one of the little milks and he's just like kicking like crazy. And
Okay.
he kicked me this really hard, big movement. I was like, whoa, that was a lot. And I remember that being like the last time I really felt him move. Like that was the last big movement. And I
Mhm.
didn't think much of it. It was just, he got excited because I had ice cream and this huge kick. And, that was kind of,
Yeah.
so I went to bed and I woke up around, it was like 1 o'clock in the morning to go to the bathroom. And I remember my stomach felt weird. It didn't hurt. There was nothing about it that hurt. It just felt hard, but it was a different kind of hard. It wasn't a contraction. I don't know how to explain it. It just felt
Mhm.
weird.
Yeah.
So I was like, huh, that's weird. So I kind of like poked at my stomach to see if he would kick. And he didn't, but that wasn't unlike him. He had different he didn't really have periods of time where he's always kicking at this time or whatever.
Right.
He just did different things. And I woke up to go to the bathroom, went back to bed, woke up a few hours later to go again because pregnancy, you have to pee
Mhm.
all the time.
Mhm.
My stomach still felt the same. It's like, that's weird that it still feels like that. Again, it didn't hurt. And I don't know anything about what labor is supposed to feel like because with Chloe, I was induced.
Oh,
I
yeah.
should say
Okay.
that. She was 10 days late. So I was induced with her.
Okay.
And induction is very different
Super
than
different.
your body going into labor on its own. Like
Right.
it looks different. It can feel different, you know, all of that. So I didn't know what it felt like when you were supposed to go into labor on your own. I was like,
Yeah.
okay, well, I don't know. Sure, it's early. He's not due for a while, but okay. Again, I'm not concerned. Poke around my stomach. Don't feel him move. Don't think anything of it. Go back to sleep. Then I wake up around, it was like 6 o'clock in the morning.
Okay.
And then I was starting to have some stomach pain. And I was like, well, maybe I just need to go to the bathroom. So I tried to go to the bathroom. That didn't fix it. I'm sitting there on the side of the bed, like, what am I feeling?
Yeah.
And it's coming, kind of in a pattern. And then I start to think, I wonder if these are contractions because it
Oh,
wasn't
okay.
so painful that I couldn't breathe through it. And I had
Yeah.
been having Braxton Hicks, but this felt different than that.
Mhm.
And I
Okay.
really don't know how to explain it. I didn't know what I was feeling and didn't think much of it. Just was like, okay, well, I'm just going to start timing them. Daniel had to work that morning. He was going to be doing a video recording. The band had to record something.
Yeah.
Chloe was in preschool at this time for just a
Okay.
couple of hours a day. Again, the contractors are still working in the basement. I very vividly remember them coming early that morning to work on the basement. And I'm just kind of sitting there on the bed, feeling this cramping feeling. And then I'm like, okay, well, I think this might be contractions, start timing them. Text my friend who's on standby to come help us. Like, hey, I think I might be in labor. Like, are you
Mhm.
able to come? She lived about an hour away from us. She goes, yep, no problem.
Oh, cool.
I just got off work. She was night shift also. She's like, but I can head there right now.
Oh.
And then I wait like 30 minutes and they start to ramp up and I'm timing them. They're every 4 minutes apart, lasting a minute. And I'm like, these are contractions. Like,
Mhm.
okay,
Mhm.
I'm going into labor. Like, this is too early.
Yeah.
So I start walking down the stairs and my husband is in the kitchen with Chloe and I'm crying. And he's like, what's wrong? And I said, I think I'm in labor. It hurts. And we just start timing it. And I again remember being in the kitchen, like leaning over the stove, just kind of like swaying, trying to
Uh-huh.
breathe through it. And he's like, do we need to go to the hospital? I said, no, it's fine. I mean, I was in labor so long with Chloe. I'll just labor at home. It's okay. They need to be closer together. And he's like, are you sure? Should I go to work? I said, yeah, take Chloe to preschool, go to work, and I'll just call you when it gets closer. Amanda's on her way. We're still really good friends.
Yeah.
He's like, I'd feel better if you called your OB. I'm like, okay. So for some reason, the number wasn't working great that morning. It took me
Hmm.
forever to get through to anybody.
Mhm.
And the OB that was on call for that day was Dr. Moore. I had never met Dr. Moore or seen Dr. Moore, but I called to tell her what was happening. And she said, well, because you're not quite full term, I would like for you to come in so we can evaluate you to see if you are
Okay.
in labor. And I said, well, I don't have anything packed. I don't have a bag. Is it okay if I shower and maybe eat something and then head there in a few hours? She goes, yeah, that's fine. And I was like, okay, not in a hurry because I feel like I have all this time and that it's not, we're still 4 minutes apart. We have time.
Yeah.
So I get in the shower and I'm noticing that they're getting closer together.
Mm.
They're now like every 2 minutes apart. And I was like, oh my gosh, this is going so much faster than it's supposed to.
Right.
And they're not so uncomfortable that, like what you see on TV or even me being at work, like you can tell when a patient is like really in labor about to have a baby
Yeah.
versus you're kind of early on in your pain level and what you're feeling and how you're responding. And I just felt like it was still going to be a little while, but
Okay.
because they weren't as intense as what people describe contractions being, again, I was induced. So when I finally started feeling contractions, I was on a pretty high level of Pitocin. And I was taking, they were giving me like IV pain meds before I got the epidural. And when that wore off and I felt the contraction, I was like, oh no, I don't want to feel this. So they were already like really strong
Okay.
because I was oxytocin as an induction. So
Yeah.
that to me was very different than what I was feeling now,
Mhm.
if that makes sense. I was
Mhm.
like,
Mhm.
okay. They were getting closer. So I knew, okay, I need to hurry up and get to the hospital. So literally just like throw any clothes on, grab a couple things for Landon, put my hair in a bun. Then I called Daniel. I was like, hey, we're at 2 minutes apart now. Like, I think it's almost time to go to the hospital. And he's like, I just dropped Chloe off. I'm not going to go to work. I'm turning around. I'm going to call everyone and let them know I can't do this recording today.
Okay.
So Amanda gets there before Daniel. And I remember I'm sitting on the couch, kind of like laying back a little bit. And I'm watching my stomach and it's doing this strange, like it's a contraction, but it would like do this really weird shape and then kind of relax, but not really. It looked really weird.
Yeah.
And I just remember laughing about it when Amanda got there because she's like, so does not ever want to have kids and like pregnancy freaks her out. So it was kind of funny. And I was like, Amanda, look at my stomach. Doesn't it look weird? This is what it looks like when you're having a contraction. And she had some things for Landon that she brought us. Like there was this little stuffed giraffe she made with his name on it and all these other little things. And, I'm getting excited because we're going to be having a baby. It's early. I'm 35 and 5, but
Right.
we'll be okay. There's
Yeah.
a NICU right across the hall. We're going to be okay. So Daniel gets there and we decide that we're going to take Amanda's car and she's going to keep ours because she was going to go pick up Chloe
Oh,
from
yeah.
preschool.
Okay.
She needed the car seat.
Yeah.
So we start to leave the driveway and I tell Daniel, wait, we need to get a towel because what if my water breaks in the car?
Oh.
This isn't our car. So we turn back and grabs a towel and, we're both just in this moment, I'm realizing Daniel was like really excited. And again, it was about a month prior that he sent me this really long text just explaining how happy he was that we were having his son. And it took him a little while for him to come to terms with it, but he was elated. And on this day, he was so excited that we were finally having our baby. And we lived on a very busy street at the time with a lot of traffic lights.
Mhm.
And I remember that whole morning, every single traffic light was green, which was weird. Like the whole way to the hospital, green light, green light, green light. I never did stop to eat because I wasn't hungry. I just wanted to get to the hospital. And, we're holding hands saying, we're going to have a baby. We're going to have a baby, just so excited in that moment. I don't think that I had felt him move since the night before, but I was in labor. I don't know. Are you supposed to feel the baby move? I have no idea.
Yeah.
Things that I wouldn't know having been induced before. I had never gone into labor on my own. I don't know what I'm supposed to feel.
Yeah.
And so we're driving to the hospital and there's this like little bridge that we drive over right as we're getting to the hospital. Like, it's right by where the hospital is. And I remember right before we got there, the contractions were now like a minute apart, like they're really close. And then they started becoming on top of each other with like no break in between, which is concerning knowing now what happened to me. And I'll get there, but that's not a normal thing at all for it to go to do with like really no break in between. So by the time we got to that little bridge, my uterus was now stuck. It wasn't relaxing at all. It was stuck. It was hard. It was uncomfortable. Again, not knowing if this is normal or not. It was like, maybe this is just what happens when you go into labor on your own. I don't know, but this hurts. And the nurses that morning, later on, they described, I don't remember saying this, but they said that I told them right as we were getting to the hospital, I felt a really sharp pain. And I said, ow, in the car. I don't remember that, but they said I told them right before the feeling of the uterus being stuck, that I felt a really sharp pain again. So we go into the hospital. Again, it's COVID. You go up to the security desk and I'm clearly uncomfortable. There's a wheelchair off to the side. I walk up and I said, I'm in labor. I need to go to labor and delivery. And she looks at Daniel and says, have you been COVID tested in the last 30 days? And he just looks at her and he runs to get the wheelchair. And I remember thinking that was so funny because I'm like, that's classic Daniel. Like, he's just ignoring her. He puts me in the wheelchair and he's like, I feel like he was running down the hall. He probably was not running down the hallway, but I feel like he was driving so crazy that I'm like, in the wheelchair, trying to get to labor and delivery. And by the time I get up there, I'm so uncomfortable sitting straight that I have to kind of do the cheek sneak. You kind of like shift onto one side.
Yep.
Which again, people who are in pretty advanced labor and the baby is like right there, it's uncomfortable to sit like that. So they'll often come in like doing we call it the left cheek snake. Like you're just kind of leaning off to the side because you're just so uncomfortable. So when I did that, the nurses when you walk into the hospital in labor delivery, the nurses station is right there. And we're a pretty big unit. So there's all these nurses that just stare at you as you come in. And they saw me sitting like that. And they're like, oh yeah, she's probably almost ready to have a baby.
Yeah.
So we go into triage. And Daniel had left Amanda's car running downstairs. If he didn't park yet, he had just drove up to the little circle where you walk in. And the car was running. And I said, can you go move her car? Because it's not our car. And I don't want it to get stolen. Like, I'll be okay. And he's like, okay. So he goes to move the car. And I'm in triage. And they're trying to get me on the monitor. And the triage nurse, her name was Courtney. She said, how long has your uterus been like that? I was like, I don't know, just since we were driving here. But it really hurts. Can you make it stop?
Yeah.
Not knowing, that she's already concerned, like, that's not supposed to happen.
Yeah.
I was like, yeah, it's just really uncomfortable. Like, I don't know. I was contracting and they were 4 minutes and then 2 minutes and then right on top of each other. And now it's just stuck. And so she goes to put me on the monitor. Don't hear anything. And then you hear like a really low, subtle heartbeat, but it was in the 80s. And I knew a baby's heart rate had to at least be above 100.
Yeah.
Like, to be normal, like it has to be above that at least. And I was panicking because I said, that's too low to be his heart rate. And she's like, that's your heart rate, mama. She knew right away that there was nothing there. And so then, Daniel's still not there. And Courtney is calling our charge nurse, KJ, who I still talk to KJ as well, we're friends. She said, can you please come in here and help me find fetal tones? So she comes in and she can't find anything. And, there's like 4 other people that come in the room, all these doctors, they're bringing the ultrasound and I'm confused. Like what is going on right now? It's just, they're getting the ultrasound. Daniel comes to the door and he said, husband's back. And he's all excited. And there's all these people. And he's like, what's going on? And I look at him panicked. And I said, they can't find his heartbeat. And, that's when they put the ultrasound on my stomach and you just see him like lifeless, not moving. You just see his hands. He's not moving. And they confirmed it. They said, I'm really sorry, but there's no heartbeat. And I think I just remember being in shock, like, what? I don't understand because, I didn't scream. I was just kind of numb, like, really don't understand what's happening right now. This is just labor. What are you talking about? With what my uterus was doing, they said, we're very concerned that you're having a placental abruption. I had never heard of that. And I said, what is that? And they said, it's when your placenta separates from the uterus before your baby is born. And they said, I think your uterus is really hard right now because your uterus is full of blood and it's trapped inside.
Oh.
And normally patients who have an abruption, they're bleeding when they come in. I was not bleeding. And I had vomited at home because I just felt awful. Like, you're laboring. Never bled, nothing. There was nothing weird about that day other than the contraction pattern.
Yeah.
And so they were, concerned about that. And they said, we can't always see it on the ultrasound. And the way that my placenta was in there and the way that he was laying, they couldn't definitively tell, but just based on my signs, like a hard, stuck uterus is never a good thing. That's not normal at all. And, they tried to get IVs in me and they're having a really hard time with that. And blood is starting to come through the IVs now.
Oh.
And that's when they, again, they have knowledge of all these things going on. And I have no idea that I'm in danger at all. None. And Dr. Moore comes in and apologizes profusely that, there's no heartbeat. And she said, do you mind if I check your cervix? Because we would really like for you to have a vaginal delivery if you're stable. And I don't know what she means by if you're stable. I'm not paying attention to that. I'm paying attention to the fact that you want me to have a vaginal delivery and torture me with a baby who's not going to come out crying or doing anything. Like, I don't want to do that, is what I'm thinking. Like, I don't want to do that. And she checked my cervix and she said I was 3 centimeters dilated. And, they're trying to do the IVs. And KJ immediately knew I was in DIC, which for the people who don't know what that is, DIC is, I see it a lot in the ICU, but it's not the same as like an OB kind of DIC necessarily, but basically it's when your body is clotting and bleeding at the same time.
Mm-hmm.
So you have this massive something bleeding, and your body is throwing all of the clotting factors it has at that to try to make it stop. And it can't anymore. There's nothing left, and you're still continuing to bleed. So it's basically a clotting cascade sort of a thing. And DIC in the ICU has always been not a great prognosis. A lot of patients don't come back from that.
Yeah.
And so they get 2 IVs in me. They bring me to room 15, which is what I call the butterfly room. It's like separated from the rest of labor and delivery. And it's where they put patients who have had a demise so that you don't hear these other happy, screaming, crying babies around you.
Yeah.
So they put me in that room, and I'm still just kind of numb at this point. Like, I still don't understand what's happening. No one's told me anything. I heard abruption, but I don't know what that means. Like, how, I don't understand that. And so they had been waiting for my labs to come back, and they were consenting me to blood products because they wanted to hang blood before they knew inevitably I was going to hemorrhage at some point, because all that blood is in your uterus. It has to come out.
Yeah. Yeah.
And Dr. Moore, even though she wanted me to have a vaginal delivery, she also knew in her mind, there's no way I can let you have a vaginal delivery because your uterus is full of blood. You're going to end up in a C-section.
Yeah.
They were just trying to get blood products in me first. They're not communicating any of this. They had a really good way of keeping me very calm during all of it, because I had no idea how much danger I was truly in at this point. And I remember sitting in the room and noticing there was no blue emesis bags, like the vomit bags, and I'm feeling really nauseated.
Uh-huh.
And so the nurse that was in the room with me, Kathy, I also still work with her. She's also a charge nurse, been there forever. She was in the room helping. So it's KJ and it's Kathy and a whole bunch of other nurses that I can't remember their face. They're blurry to me. They're there, but I don't remember them being there. I only remember KJ, and I remember Kathy, and I remember Dr. Moore. And at this point, I told Kathy, I was like, "Can you bring me a bag? I'm going to vomit." So she brings me the blue emesis bag. I start to vomit. And no, right before that, KJ had called Dr. Moore when she wasn't in the room. All my labs had come back, and my fibrinogen, which is one of the clotting factors, I don't remember what normal is, something, I don't know, like 150 to 400 or something like that. I could be way off. Mine came back less than 60, which means like you're bleeding out. Like you have nothing left in you to clot anymore. It's all gone. And when she saw that, she said that her heart dropped, and she called Dr. Moore and she goes, "She's in DIC. You need to section her now." And so, they come in the room again. They're still very calm. This is when they're consenting me to blood products. And I'm like, okay, whatever. That's why they did the 2 IVs.
Yeah.
And this is when I feel like I'm going to vomit because, they just told me that I was in DIC. And Daniel said, "What's DIC?" Because he doesn't know, like, medical jargon. And I look at him. This is one of the last things he remembers me saying is when he asked me, "What's DIC?" I said, "It's a death sentence." And that's the last thing he heard me say before the next series of events. So I said that. I said, "I'm going to vomit." She brings me a bag. I do vomit. I feel a gush. I'm like, "I think my water just broke." And she's like, Kathy was like, "Okay." And then I look under the sheet and they said, "Never mind, it's blood." So nonchalant, right? And I tell her it's blood. It's just like, okay, because again, all these nurses already know Sarah's going to hemorrhage at some point. We need to get blood in her before it does.
Yeah.
That's what they were trying to do. That's why they didn't take me to the OR immediately. They were trying to get blood in me first.
Yeah.
So I continued to vomit. And then I tell Kathy, I said, "It's not stopping." At this point, it was like a water fountain. Like a water fountain had been turned on, and it's just like
just going,
pouring out. It's just going. It's not stopping. And then I remember KJ's voice saying, we need to get her to the OR now." And then I look at KJ and I said, "I feel like I'm going to pass out." And she's like, "You're on the bed. Go ahead, just do it." And I passed out. And they wheeled me from that room to the OR. Daniel wasn't allowed to cross that line.
Yep.
During COVID, and because I was an emergency C-section and I was going to have to go under general anesthesia, you're not allowed to have your spouse in there for general. Not even just because it was COVID, but that's just a rule in general.
Yeah.
You can't have your spouse if you're under general anesthesia. So he watches me go back to the OR after I just said it's a death sentence and I'm bleeding. And KJ hits the code blue button in the OR because she said she felt my pulse and I didn't have one.
Oh.
And I woke up in the OR, like came to just as they were trying to move me to the OR table. And I remember looking down at my leg and it was just completely covered in blood. And I had no idea what was happening. And I kind of scooted over to the OR table and the anesthesiologist wanted to intubate me, and being an RT, I didn't want that. So I'm laying on the bed fighting them. They're putting oxygen on me and shaking my head. And I feel Dr. Moore's hand down by my uterus with the knife because she wants to cut. And I remember feeling her hand there. And I remember laying there thinking, please don't cut me. I'm still awake. Don't cut me. I don't want to feel this.
Yeah.
And I can't say that because I'm fighting off the people trying to intubate me. And that's the last thing that I remember. And then that's when I woke up in the ICU and I had a breathing tube and I was still on a ventilator and people are talking to me, but I can barely open my eyes. And Daniel runs out and said, she's awake. And, they come in and they do their whole, test on me to see if they can pull the breathing tube or not. And so, I was to the point where I was, they could wean me off of it and they could pull the breathing tube out. And of course, it's my coworker because they're respiratory and,
Yeah.
they're in my room and Daniel's crying and I don't remember all the details. I just know that, we lost Landon, that he wasn't there. He was gone. And Daniel just lays on me, he's crying. And he said, Landon looks just like Chloe. Like he's your twin. And I was too sleepy to see him. And I said, am I okay? Am I okay? And not even thinking about the fact, do I even have a uterus anymore? Because I don't know what happened to me back there.
Yeah.
And the nurse comes in the room and she said, Sarah, I think her name was Valerie. I can't remember her name. She said, I just want you to know, first of all, that you do still have your uterus, that they were able to save that for you. Which in that moment, it was a small relief. I'm like, okay, cool. I have a uterus. Nice. Yeah. She said, but I want you to know how lucky you are to be alive right now. Because you lost 5.3 liters, which the human body has 5 liters in it. I lost every drop of blood in my body because it was all inside my uterus. And I don't know how they saved my life, but they did. They slammed blood products into me as quick as they could. I got 16 different units of things: blood, clotting factors, cryoprecipitate, which I don't really know what that is. Just all these different things.
Yeah.
They put an art line in me to monitor my hemodynamics because I didn't have a pulse and I coded, and they didn't have to do CPR. I woke up before they had to do that part, thankfully. But so they were monitoring all my, hemodynamics, and they were shoving blood through my art line, and I'm looking down at my arms and they're so completely bruised just from shoving things through that IV. And I know that I want to see Landon, but again, I'm too sleepy to do that. And so I'm still trying to process everything that had happened. And
so when did you, can I ask really quickly? So you went under when they got him out, they saved your uterus, they got all the blood products into you, and then they brought you into the ICU, intubated, everything. Do you know how long from the time you went to OR to when you woke up was?
Yeah, so they said Landon was born at, I think it was 11:21 that morning. We got to L&D at 9 something. I woke up in the ICU around 2:30. I don't know how long it took for them to do the repair on my uterus after they got Landon out. So they delivered Landon and then they brought Landon to Daniel. And so he was holding him for, I don't know, an hour.
Yeah.
And maybe longer. And they did everything that they could to save my uterus. And they ended up putting something called a Bakri balloon in there, which is it's a pressure balloon. So it creates a tamponade effect. So they put that in your uterus, they fill it up with a bunch of saline, and it puts pressure on the uterus and all of those vessels in there to make the bleeding stop. And so
Okay.
that stays in for about 24 hours. So that was
Okay.
like their last line of defense to try to
Yeah.
save it. And that is ultimately what worked. And I remember, just when Daniel held Landon and just him saying he looks just like Chloe, but there's a lot of things obviously that are hard about this. And, I'm still not even done with all the details of the story, of course, but, just hearing the nurses say when he was born, he looked perfect. He looked like he hadn't been gone very long at all. He
Oh,
wasn't color changed. He was perfect, absolutely perfect. So much so that when they called code blue, they had extra doctors go into the OR to help. I guess there was about 20 people in the OR, and our OR is not that big, trying to help with because I was such a severe case.
yeah.
And we had extra doctors that scrubbed in to help Dr. Moore, and the chief of staff actually scrubbed in. I had never met her until very recently, actually, because she took on a new role. But she scrubbed in, and she was one of the ones to deliver Landon, and he looked so perfect that she was even trying to stimulate him to take a breath
Oh,
because she had no idea that he was a demise. She had no idea. And they said he's a demise, like, because he wasn't doing anything.
yeah.
And I think what's been hard to hear is the nurses and doctors theorize that that sharp pain that I felt right before we walked in was the placenta completely separating.
Oh,
And they think that's when we lost him. That we were just,
so
moments too late.
so close.
That if I would have gone in when I first talked to Dr. Moore and instead of waiting those few hours, would he still be alive? And one of the OBs that did the surgery, he maybe he was trying to make me feel better. I don't know. But he said, I don't think it would have made a difference because the state of your uterus was so bruised. I think you had been bleeding for a while.
Oh,
And
really?
he said, I think it was going on when you felt that hardness in the middle of the night when you kept poking your stomach and it felt weird. He said, I think that's when it was starting. And so one of my theories is, remember when I was talking about how I was eating the ice cream the night before
Mm-hmm.
and he did this really big, crazy movement.
Yeah.
He had a short cord. And so my theory is he pulled his cord too hard and tore his placenta, and it just continued throughout the night. And I'll never know that
Right.
because they never have an answer for an abruption. They, preeclampsia can lead to an abruption. I was ruled out for that 3 weeks before.
Mm-hmm.
And even that morning, I didn't have anything that would point to that. The only thing they saw was my blood sugar was high that morning.
Mm-hmm.
Untreated or undiagnosed gestational diabetes can lead to an abruption, and that it's just, there's so many what ifs.
Yeah.
So yeah, by the time I woke up in the ICU, it was a few hours after Landon had been delivered. And again, I was just so sleepy because I was on so many different things.
Right. Right.
I was on magnesium in case it was preeclampsia. They were trying to prevent me from having a seizure. That's the treatment for preeclampsia is usually we have to put you on magnesium if it's bad enough. I was on that. I was on all these other things just from being under general anesthesia.
Right.
Hadn't eaten in forever. And so by the time I was ready to see Landon, it was about 7:00, 7:30 that night.
Yeah.
So about 5 hours after I got to the ICU. And KJ, who was the one that was there that day, she had stayed late, hoping that I would wake up and want to see him. And so she actually wheeled him over to me with one of the other nurses. And I have a very vivid memory of seeing them pushing his little bassinet toward the ICU and just immediately crying because I didn't want to see him like that. I wanted to hold my son, but I didn't want to hold him lifeless. And I wasn't prepared for what I was going to see. I didn't know what he looked like yet. I had no idea. So KJ rolled him in there and they had him in like a little outfit and he was already so color changed. He was like purplish blue and he was like, really just like cold and rigid and he just was changing so quickly. And he had like blood or amniotic fluid or something coming through his nose, which I feel like was maybe like cerebral spinal fluid or something from his brain. I don't know what it was. There was something there. And the nurses that were taking care of me, they knew me from working there and they were in the hallway just like sobbing because my baby is coming and I'd just been through something so awful. And he comes in and I just hold him and I start crying and I look at Daniel. I was like, you're right. He does look just like Chloe. And we're crying and I take off his hat and I'm looking at all his features and like his dark hair and he's so little and cute and perfect. And I'm crying like silently because I just didn't have it in me to just like sob. I don't know what it was. I couldn't sob. I was crying softly like I am with you now. And, we just held each other and they took pictures and we put him in like the little outfit that we had brought for him, that we bought for him. And took pictures of that with his little giraffe that Amanda had for us. And then Courtney from Triage came over and she wanted to come check on me too before she left. And she's like, I am so sorry that this happened to you. And she said, you know what, but I'm really glad you're okay. And I'm really, really glad that your daughter still has her mother. And I just started sobbing because in all this time I forgot about Chloe. I forgot that I still had a child at home that I had to take care of. And I just sobbed because you're right. Thank God Chloe still has her mother. And, but more than that, like, thank God Daniel still has his wife.
Yeah.
And the next morning we left the ICU to go back to labor and delivery. And one of the doctors that had helped Dr. Moore with the surgery, his name's Dr. Gukas. He actually started my induction with Chloe. So I remembered him. And also when I had woken up in the OR after I passed out, right before they intubated me, I saw Dr. Gukas in there. And I remember feeling calm because I recognized him. I was like, I know him from when I had Chloe. So he was the doctor on for that whole weekend, or at least for that day that I came back to labor and delivery from the ICU, because I wasn't ready to go home, but I didn't need to be in the ICU anymore. I wasn't an ICU patient anymore. So they brought me back to that butterfly room 15. And Dr. Gukas is there, and we're just kind of, just talking about the events of what happened. And he's just apologizing profusely and reiterating that what happened to me truly was a fluke, that abruptions don't happen often, but definitely not to the level that mine was, the extreme that mine was, to come in. And he said, I don't know how you even walked in here, because you should have been bleeding with how much blood was stuck in your uterus. And then he started to say that basically that if we had left even 20 minutes later, he looked at Daniel and he said, if you would have left 20 minutes later, I don't think your wife would be alive. I think that she would have bled out at home. And Daniel just started sobbing because he was at work. And if I would have just kept waiting, he would have come home to me and just, I can't even think of what that would have looked like for him to just walk in and your wife is like dead on the floor, bled out. Like, and it was just, he immediately sobbed because he realized how lucky we were, and we're both crying, and thankful that I'm alive and thankful that I have a uterus, I guess, in that moment, but also just what just happened?
Right.
What just happened? And so we're asking Dr. Gukas if we would be able to have more children if this would happen again, and he said you can absolutely try again. I knew that I wanted more kids, and I, even before we left the hospital that weekend, Daniel and I both knew this was a terrible thing that happened, but I still want to try again. And we decided right then and there that if we ever had another boy, his middle name would be Landon. So we would name him after him. And so that balloon that was in my uterus, it was going to be ready to come out soon. And Dr. Gukas wanted to come take it out. And I remember being terrified because in my mind, you taking out the balloon is all that's keeping my blood inside. And I had this fear that I was going to just hemorrhage again. And I was so scared and I was crying. And he said, I promise you that everything looks good, but if you want me to leave it in for a few more hours, I'm okay with that. And I was like, please leave it in. I don't want to take it out right now. So he came back and then deflated it, and I'm holding my breath, and he pulls it out. There's no bleeding. Everything looks good. And he's like, everything looks great. It was anticlimactic, and everything is good. You're not bleeding anymore. And I had a whole bunch of different nurses that helped to take care of me that weekend, and I can remember all of the ones that were involved in my care pretty vividly. And one of them was a nurse named Holly, who's been there forever. She was actually orienting a nurse that day who was new to our hospital, but not new to labor and delivery. And she came in, and, she's a very nice, very sweet, very religious woman. And she has been an L&D nurse forever, like over 30 years. And she came in and, she gave me a hug and apologized for what had happened. And she said, Sarah, I've been doing this a long time. I've been an L&D nurse for over 30 years, and I've never, ever, ever had a patient lose the amount of blood that you lost and still survive to talk about it.
Yeah.
And she said, one of the blood clots that they pulled out of your uterus was the size of a bag of fluid that we hang, which is a
Oh, yeah.
liter.
A liter
She
bag.
said it was about it was the biggest blood clot she had ever seen that was just like pulled out of there. And then she said, I don't know if she heard it from somebody, or I don't remember the exact way the conversation went, but she said the way that Landon was laying in your uterus, he was covering your cervix so that you wouldn't bleed out. And that's what saved your life. Is the position of my son in my uterus, holding all the blood in. If he wouldn't have been laying like that, I would have bled. And so it was really hard to hear, but also poetic that he saved my life so that I could make it to the hospital, but I couldn't save his. Like, he was the reason that I didn't die at home, because he was laying so perfectly that his head blocked my cervix. And nothing came out until I vomited and I moved him. And then it all came out. And he saved my life in more ways than one. But that was really hard to hear that, as a mom, you should recognize, like, why didn't I know something was wrong in the middle of the night? Why didn't I go in? Like, why didn't I go in sooner? Would he still be here? Would he still be alive? Like, I was supposed to protect him and I didn't. And, 3.5 years later, it's still so hard to feel like there's something that I missed. Like, what did I miss? What did I not recognize? And then it just goes back to that feeling of being pregnant with him and feeling from the get-go that somehow I was doomed, that this pregnancy was doomed, and it all came to fruition in that moment. And later that night, a nurse walked in the room and she said, hi, Sarah, do you remember me? And I looked at her, I said, no, I'm sorry, I don't. And she said, it's Jan. I triaged you a few weeks ago. And I didn't recognize her because she had her hair down and no mask on, no scrub cap, nothing.
Yeah.
No COVID gear. And when I remembered her, I cried. I was like, oh, I do remember you. And she started getting emotional and she goes, I am so sorry that this happened. And I don't understand, because he was perfect a few weeks ago. Like, there's nothing that we missed. And I didn't think that they did. And, she sat with me for just a while and she's like, when I came in today and they told me that there's a demise on the floor, and they were all really sad, and they said, she's an RT here. She works at our hospital. And Jan immediately was so emotional because she's like, no, this can't be the same person. And she found out it was me, and she was really upset. Because I think she felt like, was there more they could have done? Is there something that they didn't see? But there was nothing. My lab work was extra perfect in that moment. And, so she really came in and checked on me a lot during that night. And she helped me do like normal things with Landon. She helped me to bathe him, because he's still my son and I wanted all those opportunities with him, but his skin was starting to, peel, and he was changing and changing so quickly. I was trying to be gentle, and it was almost like triggering for me to try to give him a bath and put on a diaper and just see like this skin between the fold of his legs, like starting to peel away. And he was just turning so much more purple by the day, and his bone structure was already kind of changing. And but I held him a lot, and I changed his clothes and gave him a bath and gave him a clean diaper, and I talked to him. And so Daniel held him sometimes too, but it was harder for him. And Jan helped to make she made like molded hands and footprints for him, and they did this whole like box of stuff, which I didn't know that. I think a lot of hospitals have like a perinatal loss program, and we have one there too. And there's like a loss box of all these different things that they put in there for you that I didn't know about until I was discharged. And so they were adding all these little things to the box for me. And the next morning was my last day there. So I came in on a Friday to have him. Spent Friday night in the ICU, Saturday night on L&D, and then I left Sunday night. So miraculously, I was stable enough to leave 2 days later.
I cannot believe that.
How,
that is nuts.
but
like,
I was.
cannot believe
It's
that.
crazy. Yeah. I was stable. All my labs are stable. Like, My blood counts looked good. Sunday morning, I had a nurse named Kelly. She was one of the last ones to take care of me. I still work with Kelly too. And she came in and, again, just apologized. And she told me that she had also had a loss at 28 weeks and that she could relate to that. And it was kind of in that moment that I suddenly felt some kind of peace, knowing that I'm not the only one in this awful club of being, having a stillbirth. And I remember I was at work. I think it was like a week before my last shift there. I was at work and one of the respiratory therapists I was working with was on Facebook or social media or something and found out that somebody that she knew had just had a stillbirth at like 29 or 30 weeks. And I just remember thinking, oh my gosh, I can't even imagine that. That has to be so hard, not knowing it was going to happen to me, of course. And I think it's hard at any age, but to be so close to his due date, one more week, he would have been technically full term. Anyway, so just talking to Kelly, I felt peace. And she said, I lost my son too, and it was a cord accident. But I've had more children since him. And she also lost a son. And she's like, I have to tell you, Sarah, I had another son after him, and he's 23 years old, 22 maybe at the time. And she said, I will never stop living in fear that something is going to happen to my son because I already lost one. And she said, we planted a garden for him, or we planted a tree. And so she was giving me ideas of just ways that we could honor Landon. And, I decided I wanted to do a garden too. And I had already known I wanted to be a labor and delivery nurse even before I lost him. It was something I always wanted to do, to be honest. But nursing was so hard to get into that's why I did respiratory therapy, but it was never joyful for me. It didn't bring me joy. It wasn't my passion at all. And so after I had Chloe and I had a good experience with my delivery, I decided I would go back to school to pursue nursing and to try to be an LD nurse, and did all the prerequisites for it. And, we really actually tried to plan our fertility treatment with Landon. And we tried to plan when I would apply to nursing school because I didn't want to be pregnant in nursing school. I wanted to be done with our kids and then pursue that. And ironically enough, I was pregnant with Bailey and Gabriel, who we had after Landon, the entire time I was in nursing school, because we planned Bailey. We did, fertility treatment when we were allowed to. I had to wait 6 months after Landon to get pregnant or to even try, because he was an emergency C-section.
Right.
So they told me ideally we say a year, but I'm okay if you wait 6 months. I'm comfortable with that. And of course, that was the longest 6 months. Felt so torturous not being able to try to have a baby again.
Yeah.
And anyway, we had a baby, and then I'm kind of fast forwarding myself. We can backtrack if we need to. So I was just saying, I was pregnant all of nursing school because I was pregnant with Bailey, had her over the summer, year one. And then Gabriel was a surprise. He was not planned. We're of course happy that he's here, but we found out we were having him about 3.5 months after I had Bailey. She was a C-section, scheduled C-section. So I'm like, oh my gosh, I just had a C-section. I'm pregnant again.
Yeah.
My goodness. And then when it was a boy, I was elated, and of course, and just like we said we would do, he has Landon's middle name. So he's Gabriel Landon after Big Brother. And he looks just like Landon. I mean, based on the pictures I have of Landon, because I only have, when he was born. But going back to what I was saying about Kelly, she was the one that discharged me, and she gave me that box that they put together before I left. And I had no idea that they had done all these beautiful photos of him, and I just immediately sobbed looking through them and all the things that they put in there. And they gave me, she gave me a weighted bear to hold on my way out. Obviously, saying goodbye to Landon and holding him for the last time was truly just the worst form of cruelty. Holding your baby, knowing you have to just leave them there. And we just cried and kissed him and said, we love you. And I don't think I've ever seen Daniel cry so hard in my life. And then, we left the hospital with no baby. Just a little weighted bear to hold. And, but you still have this pregnant belly, and people are congratulating you because it's just, you're still waking up with breast milk, which was awful. I cried every morning I woke up and felt my breast so engorged, no baby to feed. And it was just a reminder that what actually happened. And
Yeah.
wake up crying every day, and Daniel would just like rub my back because he knew why I was crying. That I didn't want this milk anymore. It was so awful. It was such torture. But your body can't recognize that your baby's not alive, So
Yeah.
but so it's just, I don't know. So my first day back to work, I was a couple months after. I only worked for 4 hours because I needed to just come back in slowly. I didn't want
Yeah.
to do a full 12-hour shift. They gave me part of the ICU to make it easy, and the part of the ICU they gave me is exactly where I was a patient.
Really?
And I kind of started spiraling, and I realized I can't be here anymore. I can't do this. I can't. And that night, I actually got an email from the nursing program saying that I was accepted into nursing.
Oh,
My first day back to work after losing Landon, and so I was like, okay. And
this.
my desire and my passion for being L&D obviously is much more intense now and greater. And I work in the same hospital that I had him, and where a lot of the nurses saved my life. And I'm always trying to honor him and make my life about his legacy. And sometimes I feel like I don't do enough. Like, I wish there was more that I could do. And then sometimes I feel guilty for enjoying my life, having days when he's not here. And
Yeah.
I don't feel like I deserve to feel happy when I have a child that I lost and he's not here. And then there are other days where I kind of spiral because I look at Gabriel and I feel like, even though I love Gabriel and I love Bailey, I wasn't supposed to have you guys. And it's not fair that I lost a child to have you guys. And it's just a different, like, even being pregnant with Bailey, when I found out she was a girl, I was so upset, so mad. I didn't want a girl. It took me a while to bond to her. And of course, I love her like crazy now, and I can't imagine not having her.
Mhm.
And then when I was pregnant with Gabriel, elated that it's a boy. But then when he was born, I had such bad postpartum depression.
Oh,
And I didn't have that with any of my other kids. It was just all these horrible, horrible thoughts. And that's when I knew I was like, this isn't how I'm supposed to feel. So I was put on Zoloft, and there's just so much that comes after it. And,
yeah.
Even though I don't want to say you move on, time goes on and you start to feel differently. I always spiral at some point, and I just go back into these moments where it's like, this isn't the life I was supposed to have. Like, I think about what would Landon have looked like at 3.5 years old. And
Mhm.
I look at Gabriel and wonder if you're a spitting image of Landon. And it's just so hard, like, everything that comes after.
Yeah. Yeah. It re- I don't think people realize that there is like, oh, you had a loss, but it affects everything. Everything, so much of who you are and yeah, how you relate to people and relate to your own kids and everything. It's so complicated. I I'm just astounded by your story and I can't believe that you basically almost died. And that is
I did.
nuts. And
And
yeah,
yeah, that's crazy to think about, especially working in healthcare and knowing exactly
oh,
what
yeah.
all of that
Now,
means.
yeah.
And 5 liters, 5.3 liters, what are you talking about? There's no
Yeah.
way,
There's
So
no way. That's crazy.
yeah. And when I came out of the OR, where Daniel was waiting for me, they did warn him, like, she's really pale. She's lost a lot of blood.
Right.
And I had blonde hair at the time, like, I had highlights. And they said I was like as white as the sheet. Like, you could barely
Oh,
tell that I had blonde hair because I was just so pale. And even Daniel was like, I didn't even recognize you.
oh,
That must have been really scary. And, I think it'll be interesting when he does his little thing later to hear like his perspective and how
of what?
he's,
Yeah.
of
Yeah.
what, because we've talked about it, and we've gone to therapy, and we've realized that grief isn't linear. It doesn't look the same
Mhm.
for him as it does for me. And what I feel, he doesn't feel. And we both just cope so differently, but no grief is wrong. So, and, and after Landon, before we had Bailey, we had a miscarriage between that too. So
Oh,
it's just, that was such a trying time in our marriage, from after having Chloe and trying for Landon, and then all the way up to trying for Bailey, like that whole period. it was so, so hard for us to
Yeah.
get through that. And I think that's another thing that, people don't realize too, is with like fertility treatment, it's just so dang hard, and
Mm-hmm.
a loss is hard no matter what. But to have gone through what we've gone through just to complete our family, and to have, lost a son in that process. And it's just, I don't know. I don't think any amount of time will ever make me okay.
Yeah. I was like, it
I
just,
survive and I put
mm-hmm.
one step in together, but there's days where it hits me out of nowhere, and I start thinking about him, and I just cry and sob because something triggered me, and I think about this or I think about that. And
Yeah.
the other day it was because Gabriel was wearing a pair of shoes that I bought for Landon, and I just cried because they were supposed to be for him. It's hard. It's so hard.
Yeah.
And Chloe was so young, and she gets confused when she sees pictures of me pregnant with Gabriel. She thinks I'm pregnant with Landon. I'm like, no,
Oh,
honey, that's Gabriel. And she's like, oh yeah, Landon's in heaven. I'm like, Landon's in heaven. So even for her, I think it's a confusing time.
yeah. Sarah, I wanted to just make sure that I hit on a few other points to make sure we tell all about Landon. And so after you guys got home, did you make any arrangements for a funeral or for cremation or anything of his body? Or
Yeah.
what
So
was your choice on that?
we opted to do cremation. I wanted him to always be with us. I didn't like the idea of having a funeral, or definitely wasn't going to do an autopsy because we already knew what happened
Yeah.
when he passed away.
Yeah.
So we did the cremation route, and I think that was like the hardest phone calls Daniel had to do, was calling funeral homes to ask, how much is it to cremate a baby?
Yeah.
And I kind of wish in that moment that one of the nurses would have offered to do that for him, but I don't think he would have even asked. But that's just not a phone call you should have to make. As
Mm-hmm.
a nurse, if I have a demise patient, I would offer to make a phone call for you, not to overstep. They're just you shouldn't have to think about that.
Yeah.
And so we ended up choosing one that was right by the house we lived at the time. We're in a different house now than when we had him. But unfortunately, it was right next to the house, and we had to drive past it often. And so when I think about our old house, and a big reason why we moved is we needed more space because we had, 3 kids now, but
Yeah.
there were so many bad memories in that house. And I
Yes.
think that we just needed kind of a new chapter. And, once I graduated nursing school and got the job as an L&D nurse, I was like, okay, let's get a bigger house. Let's move. We can afford it. I didn't want to be in that house anymore. Because even though there's memories of Landon, I feel like everything in that house is negative. It's where our miscarriages happened. It's where all the trying for Landon happened, losing Landon, coming home to that house.
Yeah.
I just didn't want to be there anymore. And so it's almost like an aversion to me to think about my old house and to think about that old funeral home that I had to drive past all the time, and remember that that's where we had to bring Landon. And yeah, so we did cremation, and he's in a little urn in our room. There's we have a whole setup for him with pictures of me pregnant with him, pictures of him. And then we have just all the things from the box that Kelly gave us. And
Yeah.
my kids aren't allowed to touch anything in there. Chloe
Yep.
will touch the weird bear and try to play with it. And I get really upset. Like, please don't touch anything here ever. She played with the urn once, and I got really upset. It's nicely sealed, and nothing happened to that. But
Yeah.
yeah, so he's in our room, and we have a whole area dedicated to him that we can look at. So
Yeah. It's nice having him close, I guess. That's the yeah. I
yeah.
think that's lovely. Sarah, I just want to say that I just think of Landon, and I'm like, oh, he likes ice cream, and he saved his mom's life, and he is
Yeah.
with you and is taking good care of you, and I just think what a life, like what a little life that is so impactful, and so grateful that I got to hear his story today, and for you to be able to share it with those who listen. And I wanted to see if there's anything that we missed, or if there's any other thing that you wanted to tell about Landon that you want to share about him.
Well, it's silly. I never ate ice cream in bed with my pregnancies after him because I felt like it was bad luck. I was like, I'm not eating ice cream in bed and
Yeah,
drinking
yeah.
chocolate. No, I just I think that he was taken too soon, but I think he was obviously intended for a purpose, and his purpose, for whatever reason, was to save my life in that moment. And, I'm a religious person, and God absolutely has a plan for my life. And I feel like I'm in the career that I was meant to be in. And I've had the opportunity to take care of patients who've had a loss, and that's always the hardest patient to take care of. But I think they've always appreciated my story and hearing you've had a loss too. And to know that I've had more children and it never repeated itself. Thank goodness they're happy, healthy, and thriving. But to just know that I feel like this is where I'm meant to be. And I know that my work isn't done. I still really want to be involved in perinatal loss somehow, just like you've given honor to the ones you lost too. But I just want to do something more. And I don't feel like my purpose is done quite yet. But I think he's really propelled me onto this journey of purpose and wanting to help other people and leaving an impact in a positive way.
Yeah.
So
That was wonderful. Thank you again, Sarah. I'm like, excuse me. I've just so enjoyed talking to you, and thank you so much for sharing Landon with us.
yes, of course. Thanks for having me.